What are some challenges you had to work to overcome as a couple in the bedroom?
For me, one of the challenges that I had to overcome was because of my injuries, I didn't feel adequate as a husband, and that's what I struggled with.
For me, it was just understanding that he was injured and it was different than before the injury.
Are there any sexual positions you can no longer perform or have had to adapt?
I think that for me, uh, doggy style position was a lot harder because of my head injury, the TBI that I had. I would feel like I was passing out.
He gets lightheaded easily, and just that kind of motion causes him to get lightheaded, and he can get dizzy and pass out. So that was one time and one position that we weren't able to do.
Are there any challenges you're still working on?
Sometimes I just don't feel like I'm good enough for her.
Medication causes difficulty. So with PTSD and a TBI, some of the medications cause issues with performance.
What products have you introduced into the bedroom?
Recently, we have used products from Sport Sheets. That seems to be working pretty good right now. It's more has spiced up our sex life.
More exciting. He knows that if, for some reason he's not able to complete the task, that we have tools that we're able to use to get it done.
That was basically the next question, which was, what have they added or changed about your relationship? But what was your attitude towards products or toys prior to your current situation?
I think we just didn't try or use anything. There wasn't really a need for it before the injury.
Then after the injury, because I can remember we were pretty into each other quite a bit, and then afterwards it was just a little bit more difficult just because I had a lot of things going on psychologically with me, with my head injury. Also, because of the head injury, also I had 2 shoulder injuries along with that, and so it was really difficult for me to position myself where I wasn't hurting.
How do you communicate with each other about sexual needs or any required alterations to your intimacy?
We definitely have to pay closer attention to each other. Ask her. It used to be that if she was ready, I wasn't ready. If I was ready, she wasn't ready. So now we try to make it so we're working on more of a spontaneous, that we just are able to both be into it at the time.
Communication. We've learned recently over the last year or so that it's important to discuss how each other is doing and what our needs are, because I think for a little bit we got wrapped up in everything that is the injury and stopped listening to each other. And I think in the last year we figured out that doesn't work.
What is the most important factor in maintaining your intimacy?
Like she said, communication is one of the most important things. Being able to introduce different things into our intimate life where it's spontaneous for us and makes us more excited about the situation.
Adaptation, knowing that it's an ever-changing evolution. As his injury changes and he changes and I change, as we get older, it's not going to be the same way it was before the injury. It's not going to be the same way it was when he was first injured. Every month, week, year brings a different need, and we have to communicate and adapt to what comes next.
What advice would you give to other wounded veterans about approaching their sex life from this new place?
Be patient. Definitely communicate. If you don't communicate what's going on, then it just creates more problems, and it definitely doesn't lead to a good sexual relationship. I think that's what we have found out the most. If we don't talk about what's going on, and that's one of the biggest things that guys feel really macho about. But honestly, if you don't talk about it, then it becomes a problem.
Understand that if you need help, if you need assistance, if you need a toy or something like that, it doesn't make you less of a husband or wife or partner. It just means that you have adapted to the situation that you're in because you are different than you were before.
Any advice for their partners?
Be understanding. Know that they are different. Things are different. You are different. As a caregiver or a provider, you have a lot more on your plate. So be understanding with yourself and understanding with your partner.
What do you wish people who haven't had your experiences would understand about your relationship?
I guess sometimes that when life does throw a wrench into what should be the most special thing for you as a couple, that sometimes you do have to go outside of the box sometimes just to keep things a little bit spicier, and to communicate is the biggest thing, communication. So
What's your attitude about sex now?
it's definitely a lot better. It's more fun for us. We've learned that by communication that I know what her needs are, and she understands me as a person, and if I'm not feeling at that time, that she knows that she can still be there for me.
And that sometimes, I think it's important to know that sometimes you do have to bring in other stuff. You do have to bring in adaptive devices or pillows or toys to make things a little more fun and sometimes even more relaxing for the other person, to be able to move forward with getting the job done.